Welcome to Performance Around the Clock, where we explore the latest research on how to keep our body and mind at our peak physical, emotional, and intellectual performance around the clock. I am your host, Professor Satchin Panda at the Salk Institute, La Jolla, California. On this podcast, we'll talk to leading scientists, clinicians, coaches, and policymakers about human performance. We'll cover different topics, including how different organs and different parts of the brain contribute to human performance. And we'll also learn how our lifestyle, that is, what, when, and how much we eat, sleep, and move around every single day, affect our health and wellness. I hope you'll join me in this journey to explore new knowledge and adapt it in our own life to improve our health and wellness throughout our life. Hi, I'm super excited to have with me Dr. Juleen Zierath, who is a world leader in many, and she wears many hats. Um, she started her career as far as I know, from exercise physiology, but she reinvents herself in every few years. And now her research encompasses type 2 diabetes, obesity, metabolic disease, and at the same time, she also is interested in how the timing of all of this in the context of circadian rhythm affects health or disease. So, Julian, this is really exciting to be with you. As you wear many hats, what is your preferred way you introduce yourself to a wider audience?
Well, first of all, Sachin, I'm really delighted to be with you to have this dialogue today. And I am working at the Karolinska Institutet,
Yeah.
where I'm a professor of physiology.
Yeah.
And I have been at the Karolinska Institutet for several decades now. And since 2010, I'm also appointed a professor of physiology at the University of Copenhagen.
Wow.
And there I'm the executive director of the Novo Nordisk Foundation's Center for Basic Metabolic Research. So I, spend my time between both of those environments, and it's very exciting and kind of opens up my world to many, many more aspects of cardiometabolic diseases.
Yeah, so why cardiometabolic disease? I mean, you were interested in exercise, and when I look at all your peers, they're continuing to work on exercise, and you have reinvented
Well,
yourself.
I started my career as an athlete, and
Yeah.
I was fascinated with how the body adapts to different exercise regimes. And I was personally interested in that because I wanted to improve my performance.
Wow.
But, my grandfather actually had heart disease. And when he had bypass surgery, they advised him to exercise. And I got really excited about that because he started a whole new life and he was exercising, and that was a part of his treatment. And so I felt like it would be really interesting to understand how exercise could be used in the prevention of cardiometabolic diseases or the treatment of these diseases. And you know the numbers better than me, Sachin. This is really almost an epidemic. The world is facing, billions of people that have cardiometabolic diseases. And by that, I mean they have heart disease, they have diabetes, mainly type 2 diabetes, but
Yeah.
type 1 diabetes, and also obesity. And we know that these diseases certainly have a genetic component, but they also can be influenced by the environment. And that's the one thing we can control.
Yeah.
And one way to do that is through diet and exercise. So
Yeah.
that's why I got excited.
Yeah, so actually the numbers are kind of terrifying because it's almost 2 billion people who are overweight or obese. But at the same time, I must say that the overweight obesity criteria that we're using in the Western world may be too extreme even for Asian people. So in China, India, and Southeast Asia, the definition of obesity may be even BMI 27 plus, whereas the Western standard is 30. So in fact, the number of overweight and obese people may be even 2.5 to 3 billion people worldwide. And then, as you said, nearly 500 million people are type 2 diabetic. And we still see that heart disease is the number one cause for morbidity and mortality throughout the world. So I was fascinated by your recent review on how three major factors. It's environment, genetic, and then the epigenetic
That's
in
right.
between. So those three. And it also poses a lot of challenges for both the individual to understand what he or she can do to prevent or manage disease, also for the physicians or the caregiver to see which aspects can be modified. Maybe you can go through genetics because most people would say that, well, my father had diabetes, so maybe I'll have. So in fact, I think the heritability is around somewhere between 20 to 50%, something around that. So it's true that if one close family member has diabetes, type 2 diabetes, then there is a good chance. But still, it's 20 to 50%. So that means there is still 80% chance that you can avoid that.
Well, there is. I mean, clearly, genes are going to be really important for our risk,
Yeah.
for the risk of obesity, the risk of diabetes, and heart disease. That's for sure. But we can modify our lifestyle to perhaps delay or prevent the development of these diseases. And I actually do think that's important because sometimes people will say, well, you're obese just because you don't exercise. And that's not entirely true. You do carry a genetic load that may push you towards an obesity phenotype, but you could potentially reduce that journey towards obesity by lifestyle factors, watching the diet, the activity, physical activity, and exercise regimes. So I'm just really interested in that modifiable lifestyle component to disease. And again, that's a big part of our research.
Yeah, so I guess you're almost saying that if somebody has that genetic factor, then he or she should be even more careful about lifestyle. So it's almost like buying a used car. And I remember when I was a student, I could not afford, so I had a used car. That means I had to take extra care of the used car, make sure that the oil is changed at the right time and tire pressure is okay so that I could drive it for a longer number of miles. So it's almost very similar.
Right.
Yeah. So then let's come back to.
Well, the
Yeah.
thing is here, I
Yeah.
mean, with your analogy of the used car, I would argue that in this case,
Yeah.
the earlier we can intervene,
Yes.
the better.
I didn't
And
want
so,
to say new car, but from
right.
not a famous manufacturer. So to
Well, we
say.
were talking a little bit on the statistics related to obesity and
Yeah.
even diabetes. We're seeing the manifestation of these diseases even in individuals at a younger age.
Yes.
And I think that is a bit of a pressure of the lifestyle factors around us. So I would almost argue that we should really start from the earliest age possible to try to take good care of that car, our
Yes. Yeah.
engine, and ways to do that are activity and the diet and sleep, well-being, minimizing stress. So taking good care of ourselves.
Yeah.
And that's important from the earliest age possible.
Yeah. But most people think that type 2 diabetes is just body's inability to manage glucose. And the thing that it relates to, say, pancreas, those who can relate to insulin. But actually, diabetes affects multiple organs. Can you elaborate a little bit on how it affects muscle, liver, all these other organs?
So, well, type 2 diabetes can affect people in many different ways. And so I would almost propose that there's different subgroups of individuals with type 2 diabetes, and that may be based on the organs that are affected. And what we do understand now is that there can be insulin resistance in muscle tissue or fat tissue. And that means that when the body produces the anabolic and metabolic hormone insulin, muscle doesn't respond to it in the way that it should. And what muscle should do is when insulin knocks on its door, it should pull in glucose into that muscle from the bloodstream and store it as an energy source. So that, I think, is one of the defects or one of the problems that people with type 2 diabetes can have is muscle insulin resistance. And that's one of the aspects my team studies.
Yeah.
And we're studying that because we know that exercise enhances the ability of muscle to take up sugar from the bloodstream and store that.
Is that insulin dependent? And
Well, it
also,
does two things. So it does two things. So the exercise initially can, in an insulin independent manner, take up sugar from the bloodstream and store that to resupply the muscle cells with energy. And that can have a blood glucose lowering effect.
so that's independent of
That's
insulin.
independent of insulin, and that happens in the recovery phase after you exercise. So if you go out and you go exercising, your muscle needs to replenish its fuel supply. And the way it does that is it transports sugar molecules into the muscle cells and stores it there for the next bout of exercise.
I see.
The other thing muscle does is it becomes more sensitive to this anabolic metabolic hormone insulin. And so that in the hours after exercise, the muscle cells are more sensitive to the insulin that your body produces. So when you eat after you exercise, your pancreas secretes some of this hormone insulin.
Yeah.
And the muscle's more sensitive, so it sucks up even more of that glucose and stores it as an energy source.
So that's the reason why physicians tell people that you should go for a walk or do some exercise before or after the meal. Right?
That's right, because of the insulin-independent effect of muscle contraction, of the exercise, to promote sugar uptake and storage.
So in that way, exercise almost acts as insulin.
Exercise, you could argue it almost acts as a medicine.
Yeah, you actually always say that exercise is medicine.
Yeah.
And in fact, this is the case because has anyone compared for a mildly type 2 diabetic, for example, hemoglobin A1C of 6.5, not too high. If that person takes a regular dose of metformin versus exercise, do they get similar effect, or how much of exercise?
Yeah, so I mean, there was one study that was published where it was a more long-term study, and it was testing conventional therapies, metformin. And surprisingly, what the researchers found was that lifestyle, diet, and exercise was perhaps even more beneficial than some of these drugs in the long term in promoting glucose homeostasis and lowering sugar. I mean, one of my most favorite studies in the world actually is a study done by my previous mentor, John Halazzi, at the Washington University School of Medicine. And it was a study done in the 80s.
Yeah.
And they brought into the research laboratory about 7 men in this case with either type 2 diabetes or something called impaired glucose tolerance. They were pre-diabetic.
Yeah.
And they had these men perform 1 hour of exercise on a bicycle ergometer for 7 days. They did it in the laboratory. I think it was 5 days in the lab, and then they were instructed to go home and do exercise on the weekends. And they did a glucose tolerance test before and after this 7 days of exercise. And when the men started, before they trained, they had glucose intolerance, which was severe.
Yeah.
After 7 days of the exercise, they had a really profound improvement in their glucose tolerance. So the investigators gave them a sugar drink, and they measured their blood glucose response to that sugar drink. And I don't know of any drug that was more potent or is more potent than that 7 days of exercise. So it really had this improvement in insulin sensitivity that we talked about earlier. And it was pretty remarkable. And so we've been trying to crack the code on how does exercise actually reprogram the muscle cells in the body to be more sensitive to insulin.
So how does it do?
Well, we think one way that it does it is by increasing the abundance of specialized intercellular proteins that move to the surface of the cell and transport sugar molecules into the cell. And another way we think it does is it boosts up the enzymatic machinery. It's sort of, if you think of the muscle as a factory, and you have a conveyor belt that moves cargo to the cell surface, and that cargo can take and carry back in fuel. We need to have more of those proteins to do that work, and we think that exercise builds up those proteins. So that's one way.
So, so that can be insulin independent or also dependent, because in this way, it can carry the insulin receptor and few other things to the surface.
That's right. So it can be insulin independent, but it can also make the muscle more sensitive to that hormone insulin.
Yeah. And also exercise builds muscle.
Well, that is the other really important feature that we're really interested in, because we know that as we all age, we lose muscle mass. And the risk there is that we can become frail.
Yeah.
And the risk of that is we could fall and break a hip.
Yeah.
And that is really very severe. So one would want to maintain muscle mass and strength and coordination, flexibility, etc., balance for as long as one can do to maintain a real functional life. So exercise does increase the mass of muscle. And just regular movement, but also the weight training that people can do. And you don't need to go to the gym and be like Arnold Schwarzenegger. But, exercises that you can use your own body weight and use that in push-ups and TRX, training. Maintaining weight training a couple times a week is really important for the functionality of your muscle and also to maintain balance as well.
Does this mechanism work the same way between male and female and premenopause and postmenopause?
Okay, so
the muscle function in glucose homeostasis.
Right. So, that itself is a really interesting question because I think that throughout the lifespan of an individual, there will be a different response to exercise. And it can be dependent on what kind of fuel sources you're eating. So if you eat certain protein meals, that might help with muscle anabolism. But there can be sex-dependent differences as well. So in younger individuals, there can be a greater effect of sex hormones, testosterone and estrogen in terms of muscle building. And as we age, it may be more difficult to gain muscle mass. As men are aging, there's less testosterone, so it's difficult to build up mass. Women will not have the same gains in muscle mass as men because of the sex hormones, testosterone and estrogen. So there are differences. But overall, what I would say overall is that generally males and females respond to exercise in a very positive way. They can increase endurance, they can increase strength, increase flexibility, balance, cognitive function is enhanced, there's cardiovascular benefits. So overall, I would say exercise is good for everybody.
But you brought up another important point, strength, because as we get older, we may not build up muscle mass, but we can increase strength. Does increasing strength correlate with better glucose regulation?
I can't directly answer whether or not strength per se. I would say that more muscle mass, because it can be a sink for glucose, would be a benefit. But I think that strength is important more for functionality. The other thing with exercise is that we forget about is that you have increases in bone density as well. And that's really important, particularly in women. As we get to menopause, we lose the hormone protecting effects, the estrogen effects on bone mass. And so exercise increases bone mass, and that's going to be very important to avoid fractures as we get older.
And coming back to, again, exercise and circadian rhythm. Let's go back one step. So we discussed how people who have genetic defect, or almost everybody has some, because there are, 700 loci or 700 potential genes.
I might not call it a genetic, did you say defect? Because I wouldn't call it
not
defect.
Not defect, but polymorphism.
We have a genetic composition. And that composition, I think, could be advantageous for one aspect of our biology and maybe a disadvantage for a different aspect of our biology.
That's the reason why those
we're diverse.
Mutations kind of survived many, many generations. They must have given some advantage. But the point is, almost every one of us might have some genetic predisposition to stay healthy or to maintain better glucose or maintain worse glucose control. And when you talked about exercise, and another aspect of your research is also on epigenetic. Although you exercise for several days or months, it can leave a mark. It can reprogram the cells so that the benefits can stay for a longer time. Can you tell us a little bit about how that works?
Right. Well, this is, again, one way that the environment can interact with our DNA, our genome.
Yeah.
And I mean, the code, our DNA code doesn't change, but the way in which
The DNA is decorated.
can change. Yeah, the chemical markings on the DNA can change. So the actual sequence of the DNA doesn't change, but different chemical markings on the DNA can change. And that can be influenced by the diet and by exercise. And so one thing that we did in the lab was to look at this epigenome, the way in which the DNA is decorated. And what we found was with acute exercise, within one bout of exercise, when we took muscle biopsies from young people and we measured the epigenomic signature, we found that after exercise, there was a loss of some chemical markings from the DNA of specific promoters of different genes that are important for mitochondrial function and glucose metabolism.
Yeah.
So what we found was that there was a loss of methyl markers, chemical marking on the promoters of these genes. And what that meant was that when these methyl marks were lost, something called transcription factors could bind to the DNA. And it was almost like putting a key in a door and turning the lock and turning the gene on.
Yeah.
So the gene was more poised to be, you could say, activated and turn on the mRNA to eventually increase the abundance of the protein that gene encodes.
Yeah.
So we found then that could be an early mechanism by which exercise can remodel the genome and turn on important metabolic enzymes to sustain more work, more endurance when we exercise.
And those marks can stay, so this unlocking, that's a very nice analogy. Once you unlock, then it stays unlocked for quite a few days or months.
It can. It can. And I think what we haven't shown is whether or not those marks can be transferred from one generation to the next.
Yeah.
So what we studied was muscle cells, muscle.
Yeah.
But there are researchers that are studying the parental and the maternal component of whether mom or dad exercises and whether or not that information can be transferred to the next generation. And with mom exercising, there's a couple ways that happens because, mom exercises, and if mom is pregnant, the environment that, the fetus is sitting in is affected by the fact that mom exercises.
Yeah.
And that can have a positive effect on the development of the fetus.
Yeah.
But it can also happen that somehow the environment that the fetus is sitting in, and also the DNA that inherits the fetus, the baby inherits, can be modified by the fact that mom exercised. And that is one way mom's environment can have an effect on the baby. And it's the same with dad. So dad exercises, it could affect the sperm, and that might affect the way in which, dad interacts with mom, and it affects the offspring.
Yeah.
I mean, that we know from studies with, in Sweden, in fact, in a northern area of Sweden, it's called Överkalix. It's a region of Sweden where studies have been done on starvation, where mom and dad had low access to food. And over a couple generations, the low access to food that a parent had affected offspring several generations later. And we think exercise might do that as well.
Yeah, and this particular idea that exercise during pregnancy, or even getting ready to be pregnant, will have a huge preconception exercise, because when the baby is growing, there is a choice whether if the mom has gestational diabetes, which is affecting a lot of people, thousands of people actually, because in the US, in a year, 1.6 million people babies are born, so 1.6 million are pregnant. And of course, the data is not very clear, but it's somewhere between 40 to 60% of pregnant women do have metabolic disorders. It can be obesity or pre-diabetes or gestational diabetes. And but there is some good data that if the mom is obese or diabetic, then that will have a huge impact on the baby's future cardiometabolic risk for the entire life, right?
But it's true also with dad. So it's not just mom. So preconception, even dad's fitness can affect the offspring as well.
But once pregnancy starts, the dad cannot do more exercise to
No,
reduce the
that's
risk.
right.
And
No, that's
so,
right. That's right.
so for the
Because there's the
mom,
other
yeah,
component that mom carries
yeah,
the
the
fetus,
environment,
and that also has a huge effect on the environment that the fetus is growing and developing in.
yeah.
That's for
But
sure.
unfortunately, there is very few research on exercise intervention or nutrition intervention, even uh, with pregnant women, because of the risk, apparent,
Mhm.
like perceived risk of
Right.
some downside.
Well, and so
But is it
there,
safe for most pregnant women to do some physical
it's
activity?
absolutely safe, but of course, I'm not a medical
Yeah,
doctor,
yeah.
so it's not my position to offer medical advice, but the recommendation is that one should continue to maintain a physically active lifestyle
Mhm.
and obviously do that in dialogue with your midwife or your healthcare profession or your doctor, um, but you shouldn't stop exercising if you're a
Yeah.
regular exerciser.
Mhm. Yeah, because those few weeks of physical activity can have a lasting impact for your baby's rest of life, and that we are seeing. And then your recent interest has been in circadian rhythms, and I was curious how circadian rhythm and exercise interact, and I guess you have done some really cool studies. So
Yeah, I'm just really fascinated with just the idea that, we've kind of co-evolved. I mean, we've evolved because of our circadian biology,
yeah,
and I mean, if you just think about it in the simplest terms, partly that's how communities were formed because we had a sleep cycle and then we had a waking cycle and we came out of our caves or wherever we slept and we congregated with other people and I think, how societies were
yeah,
developing. And just the understanding that many of the hormones that are released in our body are released in a diurnal or circadian fashion. And a lot of our physiology is directly under the control of this highly conserved molecular clock. And so I think it's just fascinating. And I mean, you study this a lot, but many of my peers just don't even take that into consideration.
hmm,
So I actually think a lot of the variation that we find in responses to therapies and just some of our inter-individual variations can be related to when we measure something
yeah,
because we have these changes in our blood glucose control throughout the day, our hormone levels, our body temperature. And a lot of that's driven by this molecular circadian clock. And there's, some evidence that even our muscular strength and endurance, we have certain times of the day where we're stronger.
hmm,
And most world records are broken in the afternoon,
yeah,
So I just started to think about that clock and how it steers so much of our metabolism. And then with my background as an exercise physiologist, knowing how potent exercise is to reprogram cells and drive metabolism, I just thought, well, maybe exercise is one way to fine tune the clock because there's many factors that are called Zeitgebers, which
yeah,
are timekeepers,
yeah,
and they're hormones and nutrients, and they act on peripheral organs, liver, muscle, fat cells, and all of those same organs are dysregulated in diabetes. And all of those organs are affected by exercise. I
yeah.
mean, we talked a lot about muscle, but fat cells and liver are also affected with exercise. So I just started to think, wow, well, maybe exercise would be one way to reset a dysfunctional clock in people who might have
Yeah.
altered circadian rhythms. And so that's why we were studying this.
Yeah, in fact, exercise also affects the brain. And there was a interesting study where the mouse had no clock in anywhere in the body. Of course, the mouse could not sleep in a regular basis. But then when they reactivated the clock only in muscle, then the mouse went back to regular sleep schedule. And that was really amazing that
Yeah,
a muscle clock regulates when the mouse was sleeping.
yeah.
So, and we know that a lot of people means I also experience that if you're physically active throughout the day, then you sleep much
You
better.
sleep better. Yeah.
So going back to the hormones, there are many hormones which are also regulated by the brain, and in fact, most hormones have some connection to the neuroendocrine
Sure,
system.
yeah.
So in that way, exercise can have this indirect effect through neuroendocrine system to modulate many hormones. And we know that cortisol, for example, is a very strong um,
Signal, yeah.
signal from from exercise. So now there are also different aspects of our physiology that affects our exercise capacity, or as you said, strength, for example, body temperature.
Endurance, yeah.
Body temperature, we always warm up before our exercise, and if our body is already warm at a certain time of the day, then maybe we are more likely to do better.
It's possible. I don't know if anybody's really studied that. I mean,
Yeah.
what we have studied in an initial work is with people with diabetes.
Yeah.
We studied the timing of exercise. So whether an individual exercised in the morning around 7 o'clock in the morning, 8 o'clock in the morning, or in the afternoon, 4 or 5 o'clock. And we performed a small study, and it was a crossover design. So the same person they did three things. They initially came in and had a baseline measurement with a continuous blood glucose monitor. So we could monitor blood sugar levels over days.
Yeah.
And we,
every 15 minutes.
pretty much, yeah. We could get this kind of curve with the blood sugar. And you know that when you eat a meal, your blood sugar goes up. And if you have diabetes, it goes really up.
Yeah.
Then it kind of comes down. You have lunch, the sugar goes up. You know, every meal you have your...
Yeah.
And so, you know, we fitted these people with monitors, and then we had them come into the lab on 2 occasions. So they were randomized. So they either would come into the lab, and the first experience was to get on a bicycle ergometer and do sprinting exercise, high intensity interval exercise training, either in the morning for 2 weeks, Monday, Wednesday, Friday.
How many minutes?
They were doing, you know, 6 times 1 minute bout, but they had a warm up, then they did the high intensity training, then they had a warm down. So Monday, Wednesday, Friday, and then they came the next week, Monday, Wednesday, Friday, and then they had a 2-week washout period. And then they came back, and if they had been previously in the afternoon, then they came to the lab in the morning, and they did this test again. And I thought from the beginning that the morning training would have the greater effect in lowering blood sugar levels, because that's when these people have very high blood sugar levels.
Yeah.
But you know, we found that when these people performed the exercise in the afternoon, that had a greater effect to lower the blood sugar. And it also improved their nocturnal blood sugar levels.
Nighttime.
So the afternoon exercise was more beneficial to have a blood glucose lowering effect that was also lasting into the evening. And they didn't get hypoglycemic, but it really improved their nocturnal blood sugar.
Yeah.
And strangely, the morning exercise actually led to an augmentation, an elevation in the blood sugar.
Wow.
So it was, you know, I wouldn't call it deleterious, but we didn't see what we expected, the blood glucose lowering effect. We actually saw a rise in the blood sugar.
Yeah.
And I actually think it might be because the liver is a producer of glucose in the morning. And the liver is pumping out a little bit of blood sugar for the brain.
Yeah.
And I think that in the morning exercise, the liver wasn't able to turn off that production of blood sugar as readily. And that's why there was still a rise in blood sugar. And so right now I would recommend that if a person has type 2 diabetes, they might consider doing more high intensity exercise in the afternoon or evening.
Yeah.
And that might have an improvement in their blood sugar.
So it sounds pretty easy, because they did only 3 days in a week, every alternate day.
Right.
And it's a warm up and then 6 or 7 cycles of 1 minute high intensity.
Sure, yeah.
And that's doable for a lot of people.
Yeah, it is. Yeah, and we're following up on that now.
Yeah.
We're doing a more controlled study now where we're really calibrating the food intake and studying both sexes, men and women. And we haven't really done this in healthy people. We've only done this in people with diabetes. So we actually want to do a study in individuals who have normal glucose tolerance and see whether that matters to them.
Yeah. Or actually even pre-diabetes, because you know there are
absolutely
almost 2 or 3 pre-diabetic to 1 type 2 diabetic in the US.
That's
and
right.
Worldwide there may be more even.
Yeah, so I mean that actually would be a really great place to intervene.
Yeah.
Because generally people who have impaired glucose levels, they either have glucose intolerance or they have fasting glucose levels. You call them pre-diabetic.
Yeah.
They may never become diabetic. They may always be on that cusp of pre-diabetes. But one way to try to, to prevent the development of diabetes is by exercise. And it doesn't cost a lot. Get on an exercise bike, do a little training, and it can have a real improvement in glucose homeostasis.
But in this study, were the people who did afternoon exercise, Were they going home and eating after that? Or?
Well, they did. And we, like I say, now we've done a follow-up study where we've really controlled for the diets. And so even in our follow-up study, when we calibrate the meals and we give them the meals and they're having an isocaloric diet, so they're not underfed and they're not overfed. So we tell them, this is when you should eat, this is when you should exercise. Irrespective of the diet, we still see that the exercise per se has an improvement in lowering the afternoon glucose and the nocturnal glucose if the individual exercises in the afternoon.
Yeah, but the same person when exercises in the morning, the benefits are negligible, or in some cases,
when the same person exercised in the morning, they had a worsening of the blood.
Worsening of the blood.
Yeah, it was a worsening of the blood sugar.
So that was really surprising.
That was surprising.
Because even you also, we always say that the first rule is exercise.
Well, yeah. But all right, so what I would say is a caveat is that the exercise regime was high intensity interval training, and that may impose us stress.
I see.
And as I mentioned before, when you have a lot of stress hormones on board, that also makes cells a little resistant to insulin. And they may be a little bit more resistant. Yeah, they may be more resistant in the morning. And then that stress of that high intensity exercise makes the cells work poorly. So maybe you could do endurance exercise in the morning, a lower stress. Maybe walking in the morning is more beneficial, and strength training and high intensity exercise may be more beneficial in the afternoon. But we need to test that in the lab. So it's sort of my hypothesis right now. But of course, we want to have evidence-based recommendations.
No, it's and then they were just waking up and coming to the lab because and the cortisol peak also happens an hour after waking up.
That's right. So all of that was like a perfect storm. So it might just be that the kind of exercise, and also when you become more familiar with the exercise. So if your normal routine is to get up in the morning, go to the gym, you become accustomed to that, and it's not as stressful. And you may not have that worsening of blood sugar under those conditions.
Yeah. But the afternoon exercise, there is also some literature showing afternoon exercise lowers your blood pressure much better than morning exercise. So we know that many people with type 2 diabetes, they also have hypertension.
Well, it's cardiometabolic disease.
That's right. And in the US, nearly half of the adult population now have hypertension to some extent. Some people call it mild hypertension, but still.
Well, the other thing, you're more insulin sensitive then too. And I think that you need to produce less insulin, and insulin can affect the vasculature, and it can affect the cardiovascular system. Too much insulin on board is not good for the cardiovascular system either. And so all of these things to make muscle cells more sensitive to insulin are good for your body.
But then again, this afternoon exercise, what we're talking about is at least 2 to 3 hours before the person goes to bed, not some people hit the gym around 9 or 10 o'clock at night.
All right, so that I would also, cautionary note, what I would say is if you do really high intensity exercise, that really gets you pumped up. And it may affect your sleep quality. And so at least as an athlete, I always recognize that. If we would have a training session at 7 to 9 o'clock at night, and if it was a high intensity training session, it was really hard to fall asleep because I was just really, revved up. And I think that may affect people in the general population as well. So it's important to really, pay attention to the fact that too much strenuous exercise too late in the night may disturb your sleep quality.
I guess it comes back to your earlier comment that we have to come up with personalized care.
Well, and
this is where once in a while I hear people saying, I can go to exercise 9 o'clock, I can still go back to sleep perfectly fine. But some people, even I cannot fall asleep if I do evening.
No, and I think, that's the thing that is really important is this personalized or precision approach to not only medicines, but therapies. And I consider exercise as one of these therapeutic approaches, So one could personalize that. And it doesn't mean that you should never exercise at one time or the other. I think it's important to really listen to your body because generally you know your body better than anybody.
So now to wrap things up, neither you nor myself is a medical doctor. But at the same time, myself at least, I know quite a few of my family members or friends who have cardiometabolic disease, and you might also know. But being scientist, what do you think? You can ask your friends, family members who have cardiometabolic risk factors what they should do, or at least discuss with their physicians, starting from diagnosis. So, for example, what kind of test they should do, how frequently, once a year, twice a year, and what kind of food and exercise they should be doing.
Well,
Because I
that's
know that this is not medical advice, but this is something.
so like recommendation, I guess, what is what
Let's
it would
put it
be.
this way:
Yeah,
exercise is medicine,
yeah.
but we don't need a prescription to do exercise.
No, except what I would argue is that in some ways it's a pity because, one could prescribe exercise
Yeah.
and intervene in an early age before there's a manifestation of a disease.
Yeah.
And I think it should be encouraged. And I also think that it should be a part of the work-life balance. So a great way to take care of your employees is to make sure that they get time for well-being and exercise. And so that's a small investment that can have a huge payoff, So making that a part of the daily life for employees would be important. So, I mean, one thing one could recommend is that it's important to have regular checkups and indices that one
Once
could
in
have.
6 months.
No,
Year.
I don't know that one has to go every 6 months, but
Once a year.
so one way to look at this is that, it's good to get a blueprint and a baseline.
Yeah.
And, even if you feel well, it's not a bad idea
So I
to
guess
go
this
and
is
get
a very important point
yeah,
because
you can get a baseline.
Yeah.
And, you could keep track of the different biomarkers, LDL cholesterol, HDL cholesterol, blood pressure, blood glucose levels. There's certain biomarkers, liver enzymes that get reported to you in a standard clinical chemistry test that your general practitioner can do with just a blood test.
Yeah.
And if you go every year, let's say you go every year on your birthday, and you start to do that, let's say you start to do that, I don't know, at age 25 or something, and you start to collect a diary.
Yeah.
And you may learn things about yourself, and you can see if you've had an infection. So, I mean, at least I think that's something manageable and reasonable, and people could do that. There's people that look every day. I look at my watch and look at my heart rate, and I look at my body temperature, and I'm really interested in that.
Yeah.
So we can have these
wearables.
We can have wearables, and we can learn a lot. It's just a level of how interested in you are in that. But I think these kinds of clinical chemistry tests are a relatively easy way to get a blueprint of where you're at. And then you might, after 20 years, be able to see, wow, my HDL has been creeping down, or my LDL has been creeping up. And, you get an index. You could even find out, you could have irregular platelet counts or something. So it's a good way to find out. You know what? Another test that's not given would be a maxogen oxygen consumption test, a VO2 max test.
I see.
Your oxygen consumption and your aerobic capacity.
How do you get that done?
Well, an exercise physiologist could do that. You have people that work with adult fitness, or clinical physiologists can do this. Work at EKGs, where you do not just resting EKGs, but work EKGs, where you're walking, or stress tests. Stress tests are really good for you to get a blueprint of how well your heart is functioning.
Yeah.
And a VO2 test, which is, I don't think that's something regularly given, but if you had a measure of your oxygen, your maximal oxygen uptake, we know that is correlated with lifespan and life quality. And, when your VO2 max starts to drop, you have a really compromised life. So I actually think it's a good test, and you could see, well, my VO2 is getting, it might motivate you to do a more exercise program.
Because you can increase your VO2 max.
You can increase it.
You can increase 10 to 20%.
Yeah, so I think that's a great test. And another test, if I were going to develop a bunch of tests that we could, I'd have a VO2 max test. I'd have some strength test.
Yeah.
Strength and coordination, and if you can implement that early, then you get a baseline, and you can see how things are changing, and you may be able to work with a fitness coach on improving some of these parameters. But you have to be really motivated to do that, And that's a big factor as well, because not everybody likes to exercise.
Yeah.
And sometimes when you have cardiovascular disease, cardiometabolic disorders, you feel like it's harder to exercise.
Yes, that's true. There are a lot
Yeah,
of people that do have, joint pain, and
yeah,
now we are learning that high blood sugar can modify some of the extracellular collagens
sure.
even, and then that can make them even weaker, and they cannot exercise. So
So I do think having guidance with healthcare professionals is really important to
yeah,
get that
because they
baseline.
can. Yeah, so the baseline is a very interesting idea
Yeah,
because I have seen people who have hemoglobin A1C pretty healthy, 4.5 even,
yeah.
and they go many, many years with 4.5, and all of a sudden they would go up to 5.5. If they're going for the first time and getting that checked, 5.5, the physician will say, no, you're fine,
Right.
don't worry. But this person got really worried because he or she knew that
Right.
is around 4.5. It's a 1 point jump in 1 year. That's
So we talked about
worrisome.
precision health and
Yeah,
precision medicine. I mean, we're going to have different baselines.
yeah,
I mean,
yeah.
I know somebody who has an incredibly low heart rate. I'm like, are you dead? You know, and other people have higher resting heart rates.
Yeah.
And so we all have sort of our individual fingerprint. We're really different, and nobody really knows that. We're
Yeah.
all basically compared against ranges. So this is sort of the range, right? This is the low end. This is the high end, but you don't really know where you are in that range.
Yeah.
So if you start to collect data on your baseline, you actually can know where you fit. And
Yeah.
you might be able to see that, oh, I'm always on the low end of this. And now I'm average, but boy, average for me is high.
Yeah. So
So,
it's almost like, everybody knows about what they like to eat, what their food preferences are. And for spicy food, for example, in a restaurant, they can always know they are 5 out of
right,
10. So
right.
similarly, we just have to make that as a habit to know, okay, so these are my numbers. This is my heart rate, this is my LDL cholesterol. And then as we go, as you said, just take an appointment around your birthday.
Right.
And that's easy to remember. Get those numbers and then compare.
Well, and we use a fancy word in the lab. We call that deep phenotyping,
Yeah.
and we try to really kind of get a picture of you as an individual. And honestly, I think that as we learn more, treatments will be tailored towards that phenotype that you have.
Yeah.
And so this is one way to kind of be ready for that.
Yeah. So to finish, I mean, at one spectrum, we have obesity or type 2 diabetes that affects multiple organ systems. At the other end spectrum, we have exercise that also affects multiple organ systems. Um, is there anything that we missed about exercise affecting any organ system? For example, digestive system or the kidney or the hormonal system like the adrenal?
Yeah, I mean, so I'm not an expert in those areas, but I think it's just interesting to note that, you have that spectrum where exercise has positive impact on, bone, on liver, on fat cells, on the brain, on muscle cells, the heart.
That's already like 90% of
Yeah,
the
so
body.
many organ systems,
Yeah.
and well-being. And then you have diseases where there's breakdowns in all these organs I just mentioned. And so there is a way to use exercise, because I think it's pretty potent, it's pretty
Yeah.
powerful, to mitigate or to maybe fine-tune some of those issues that we see coming up with obesity and diabetes and cardiovascular disease. And I'm just always so surprised that it's difficult to prescribe it, like you were saying, and there's no reimbursement for it.
Yeah.
But more people should try to understand it better,
Yeah.
in the healthcare profession, so they can be better prescribers of exercise. And I think there need to be better systems in place in our daily lives, in our workforce or our support systems, to ensure that is protected time, that we all get to do that and not feel bad about it.
Yeah.
So, and finding things that we like to do and having a variety of these different activities so that we can enjoy physical activity and exercise for the whole spectrum of our lives.
Yeah. One last comment. There are very few women in science who pursue exercise as a research topic, and you are one of very few. And when I talk to young students these days, they always see exercise, they equate exercise with athletic performance. And since they don't see the connection to disease. And what you are actually doing is to bring exercise as medicine, not exercise for peak performance. There are a lot of people who are doing that. What is your advice to get this field grow, to get more women into this exercise physiology, exercise as medicine aspect of research?
Well, all right. So I would probably have advice to any early career stage investigator, male or female. I mean,
Yeah, of course.
Because I mean, a lot of people want to study the elite athlete because it's just they find it to be very exciting, and they can either live through the athlete or it's just very exciting. And you know, I think it's important to be able to help athletes reach their potential.
Yeah.
That's important. But you know, there are so many people that are somewhat below their potential, and one could do a lot to help them raise their potential, and on a scale that rise in their potential would be greater than any Olympian in my mind, because it's health promoting. And so I think if one can just see the impact that this can have on people's lives and really the joy that gives them, that's really remarkable. And I mean, in terms of getting people more involved in the science of this, you know, I mentioned a little bit before, I mean, people used to think of exercise as sort of just the gym, you know, but we're understanding now, I know so many people now that we're only studying, you know, fundamental mechanisms of biology, and they're all chasing exercise because it's the plasticity of the organs, the muscle, the liver, the fat, the brain, to respond to exercise is phenomenal. I don't think there's anything that pushes these systems as great as exercise. And there's so much more biology there that we want to uncover. And so to me, it's the most exciting area to be in today. And so, you know, that's how I would try to encourage people there. There's so much we don't know about how these organs respond, and people can really make a big impact. And then the impact that has on human health is going to be tremendous.
Yeah, so I always say that, for example, if you're an exercise, say, coach, your contribution to some elite athlete to go from, say, running 100 meters in 10 seconds to 9.8 seconds, that still, it makes a big difference in terms of medal. But then, if you put that effort into hundreds of people who actually cannot make 100 meters in 20 seconds, they will actually have a huge improvement. And they, in their personal life, they will reach their personal peak performance.
Exactly. So, you know, I have this idea that everyone should train like an athlete. And so, you know, even a person with obesity or type 2 diabetes should train like an athlete. So, you know, you should train for strength, you should train for endurance, you should have a regular program, and you should have some kind of goals that you set. And I think that all of us can be athletes. No, we're not all going to get a gold medal in the Olympics, but I do think we can all think of ourselves as an athlete and just train for that.
Yeah, but you brought up an interesting point that people who are overweight or type 2 diabetic, their delta is actually much bigger. Means for little exercise, the benefit is much higher than other
and
sports.
I mean, I think everybody in the world should see themselves as an athlete, and we should all try to maximize the potential. And that's going to have a big impact on our health.
No, I can clearly see that exercise can really move the needle when it comes to those 2.5 billion overweight obese around the world, and 500 million type 2 diabetes, and 2 billion maybe.
But the challenge is to actually get it into the lives of people, you know, to really make it a part of our to make it a part of our daily living, and that it's accepted, that there's protected time for it, that it's encouraged, that, you know, it's we brush our teeth every day, and everybody just does that, and you don't think about that. But just having exercise being just as regular as that, and somewhere people feel very stressed, and that's usually the first thing that goes from their day, and it needs to be in the day. It doesn't have to be the first thing in the day, but it should be in the day. And society has to really allow people to feel like, oh, this is important, I need to continue to do it.
Thank you so much. Means we touched many aspects, from molecular biology of exercise to what can individuals do, and we briefly touched on public policy. Because when public policy changes, then that changes many things.
That's right.
And we can see that means countries where public transport is there people actually walk more because they're walking from their home to the next bus stop. Whereas in the US, I just walk from my kitchen to the garage.
Yeah, well,
So this is another example where the public policy actually plays an important role.
absolutely.
Thank you so much. It was really wonderful going through all these topics, and hope to catch up with your new research again.
That's great. Thanks
Next
a lot for
episode.
having me. I really enjoyed it.
Thank you. Thanks again for listening to this episode of Performance Around the Clock. I'm your host, Professor Satchin Panda. I hope you learned something new and found this episode exciting. If you did so, please leave us a comment. If you like the science that we discussed and would like to make a donation to research in my lab at the Salk Institute, you can do so by going to panda.salk.edu/giving. Thank you again for listening, and I'll see you next time.